I'm AJ Blood. I'm a cardiologist and critical care doctor at Brigham and Women's Hospital in Boston, Massachusetts. I work with the Accelerator of Clinical Transformation team, ACT team at Brigham and Women's, looking to bring guideline-directed care and a scalable chronic disease model to patients. Yeah, absolutely. I think there's an enormous amount that can be done in that space. And I think being able to integrate and connect all the devices, wearables, sensors, and being able to pull that together with clinical data, so labs, medical conditions, to create kind of risk profiles. And in my opinion, really being able to go upstream and actually, before they come to the hospital, before they have that admission or that sentinel event, being able to treat, prevent as much as we can is really where there's a huge amount of opportunity, so that we can actually really prevent these deteriorations, decompensations, and getting to a place where somebody needs a hospitalization to really get them back to stabilization. So I think absolutely the key is being able to tie those and weave those data pieces together to find patients who are at risk of deterioration, to get upstream of that event and treat them as quickly as possible is going to be key in terms of improving overall outcomes and improving health. Yeah, it's really good questions. I think having the ability to connect and weave those data pieces together is extremely important. And right now, a lot of these are siloed, and it makes it very challenging for healthcare providers, but also for these individual tech companies and healthcare systems to be able to create really robust models. I think it's going to take some innovation around the systems and structures, as well as the data models, to pull together the necessary information to create those systems that will help to care for patients and populations that I think will be there in the future. I think regulation around data security, around creating systems and networks, data pipelines and lakes that can allow for those to seamlessly be integrated are really going to be important, and a stepping stone to get us to that future system that's going to be able to take care of these populations scalably, efficiently, and ahead of time before we hit these deterioration inflection points. Yeah, absolutely. So I'm very fortunate to work with an incredible group at Brigham and Women's, the Accelerator of Clinical Transformation Research Group. We do chronic disease management in an algorithmic, scalable fashion where we build teams of health coaches and navigators, as well as pharmacists and nurse practitioners, to set a level of intervention to a patient and help them reach guideline-directed targets for management of chronic conditions kind of across the cardiometabolic spectrum: hypertension, hyperlipidemia, heart failure, diabetes, even working into things like obesity and chronic kidney disease. Really excited to be a part of that team. Yeah, it's a great question. So to help people reach their targets, it's a little bit individual. We try to individualize each care plan for the patient so that they're able to really get exactly the care that they need and that works for them. So anywhere from 3 to 6 months, depending upon if we're managing their diabetes, their hypertension, their cholesterol, and their heart failure. It takes a little bit more time to stepwise get through each of those disease states. And if it's just hypertension, usually 2 or 3 months is all we need to help them get the data that's necessary. We do send them home with a connected device so that seamlessly flows into our electronic health record, so that we can make management decisions based on data that's in front of us on a regular basis. And I think we do the same type of data integration on device for weights and scales, for diabetes and glucometers. So really being able to tie that in, we're taking it from a health system perspective and capturing the patient population that really already works with our care providers in primary care and specialty care, and just really trying to smooth that process out. So we're not seeing every 6 month or 3 month high acuity interval visits, but throughout their journey, day to day, we're interacting with them, communicating with them, making their care easier to consume and easier for us to deliver.